hold it that way? Can you do that?
Guess not.
We're live.
Oh, we're live. Hi, everybody. It's Dr. Linda of the Vascular Birthmarks Foundation. We're having technical difficulty. I'm not sure if you can see me. Well, this says, see, I'm not seeing, let's see if this will show. Please let me know if you can see me. It says comments. Oh, okay. Thank you. So anyways, we are having technical difficulty. So I'm on my phone. Unfortunately, I cannot connect via my laptop because of the way the event was created on our page. But it's okay. I'll have a tired arm for an hour while I'm holding it. But anyways, welcome to the February 2023 VBF Facebook Live from Miami with Dr. Anna Duarte.
Hi,
right
everyone.
Here. She is you can tell your titles.
So, hey everyone, my name is Dr. Anna Duarte and I'm the Division Director of Dermatology at Nicholas Children's Hospital and also the President and Founder of the Children's Skin Center, which is a private practice dedicated primarily to seeing children.
Thank you for that. And so I see people are on, which is great. So what we will be doing today is taking your live questions. Also, Dr. Duarte will be with us in New York City in October for our super clinic, laser day, ultrasound, all of those exciting things. But more important, tomorrow is our free laser day here. So we're very excited, and you're excited to see our laser babies and laser
Absolutely.
adults. And we're going to talk about laser treating port wines and also the treatment of infantile hemangiomas and some other cutaneous vascular lesions if you have questions. I'm seeing that you're all on. I see Sergey. Hi, Sergey. We see you on. And I see some others. So we can take your questions. Again, I'm holding the phone so you can see both of us and so we can see the questions. I'm just going to take a look here and see if it's showing up on our page, because I don't know if it's showing up. See, I think that this just is not connected. Yeah, because see, it's not showing you and I, but it should be showing us. Because I was thinking we could see the questions on there. You can, so I see 8 of you are on, and we will take your questions. Again, I'm just having a little technical difficulty here. I'm trying to check this page and see why it's not showing up.
Do you want to try to use that?
Use this to hold the
phone? Yeah, so you don't have to.
Oh, great. You have to get around the, oh God, all right.
That's good.
All right, thank you.
Progress.
Yes, okay, so. I'm seeing, okay, there's 9 of you on now, and again, sorry, but it is not showing up here.
Look, they have like little hearts and people
I know,
on.
so I see they're on. I don't see any questions yet, but it is not showing up on our Facebook page, but people are seeing it. So maybe it's the Wi-Fi connecting here for mine, but the phone is working, so that's good. So anyways, no. You're not joining us on video. Get out of here. You can try. So we will take your questions. So Fabrice, Dolores, Rolatana, Maybell, Danielle, Scott, hey, thank you for coming on. Scott, we had a problem. We had a technical difficulty with the way that the event was created. It did not allow me to go live from my laptop, so we have to use the phone. So it's a little technical glitch that we have to get straightened out until for next month. But we're using my phone because the laptop won't connect to the live. It won't allow me to go live from the laptop. But anyways, we're here. So while we're waiting for some questions, I want to make sure I'm not missing any because you have to scroll. So are you using any new lasers these days? I know you like the V-beam, but anything from Lutronic, anything new from Candela?
So right now we're using the V-Beam Perfecta, which is a candela laser, and honestly, it's a great laser. Some would say, you know, top of the line, no better laser. I am starting to do some research on a different approach to these lesions, which is called photodynamic therapy, in addition with a broadband light. It's a green light. So that's actually new and hopefully showing some promise. These are some studies that are coming out of China, and they've shown some very, very promising results. One of the more interesting things having to do, Linda, we talked a little bit about this, is patients with residual fibrofatty changes.
I'm very excited about this.
With infantile hemangiomas. So there's a technology that's called radiofrequency microneedling. That is not a laser, it's a device, a radiofrequency microneedling. Again, not a laser. Some people confuse that, so I just want to make that clear. But what this does is it creates little holes in the skin from 12 to 24 if you're using a Morpheus 8. That's a trade, one of the brands. And it delivers some heat, which you can control. You can control the depth of the needles and the heat. And if any of you out there have infantile hemangiomas as kids, and sometimes you'll have this residual fatty kind of redundant skin, this is a really nice way to help tighten that skin and reduce some of the fibrofatty changes. So I'm only getting started on this, and I'm seeing good results. So I think it's something exciting that may gain some traction.
And just, you know, think about this, any of you parents that had a child that had a hemangioma, and whether you took the beta blocker or let it go away naturally, 70% of these leave a little bit of a cosmetic deformity, like a little clump of fat, or just the skin doesn't look right. That's this new technique. That's gonna smooth that out and make it look more normal. Probably a couple sessions, right?
It's a few sessions.
Like with
everything with you know, with these treatments, whether it's laser or this microneedling device, it's multiple treatments. And again, you know, just talk to your doctors about it and see if they offer the technology. It's just something that we can add to our armamentarium. So a lot of times we're treating some of the residual scarring with the pulse dye laser itself, and sometimes we're doing that with the Fraxel laser, and there's a non-ablative and ablative Fraxels, and some CO2, which is an ablative laser. So there's a lot of different ways to manage this superficial change that you see in the skin, and the radiofrequency microneedling is just one more tool that we have, which I'm excited about because it's not ablative, it tightens and it removes some fat. So it was created for a cosmetic applications, you know, remove little fat pads that we might get as we age. But if you apply the science, and that's similar to what happens in an infantile hemangioma, that doesn't involute completely. So I'm excited to see how it goes.
I love this intuitive medicine.
Yeah.
Where you see a device and how it works, and then you say, how can I apply this to my birthmarked population?
Exactly.
This is where the changes come in.
Yeah.
So we have a question from Rolatana Gomez. Hola, mi nombre es Rosana. Her name is. Mañana tengo appointment con ustedes.
Muy bien. La vemos mañana. She's saying she has an appointment tomorrow. So.
Oh, yay. We'll see her tomorrow. Awesome. So we'll see you tomorrow. Can that be done instead of surgery? Yes. Yes, Jessica.
So we would have to see the lesion, of course, but it's just one more option. So before you have an incision and suturing, which sometimes is necessary, and it could be that this is used in combination for the more superficial, like just the fine tuning. So every case is going to be different. I just think it's exciting to have this tool.
Option. And you can send your pictures, and she'll give you an opinion, and you'll be seeing, our staff will post Dr. Duarte's email in the string here. You can email her a photo. She'll give you an opinion. You can come in and try it and see. It's not instant, right? We talked about this, like when you do it, kind of like liposuction or anything, you have to wait for a while to see the full effect, right?
I have a patient that really within a month saw improvement.
Wow.
Significant improvement. So I'm excited about it. I don't have a lot of patients that I've treated with this. It's a pretty new technology and a very new application for it. So cautiously optimistic. Certainly, there's really no downside to it. So we numb the skin locally, let's say, and I mean, it's not going to be for huge lesions. So small to mid-sized lesions with some topical numbing, because it does hurt. I think it's something that's worth trying. It may be something that's going to be used in combination.
Right, and that's the whole point too, is because surgery, well, you've got general anesthesia, then you've got OR time, and like a good chunk of these get denied because they say it's cosmetic because it leaves a redundant tissue behind when it's not cosmetic.
Reconstructive,
definitely. It's reconstructive. So anyways, I'm excited. And so Scott says he's having the micro needling RF with Dr. Geronimus, and a couple of his other friends are, and they're getting dramatic results.
It's great.
Actually, Megan Curley was one of your patients, and she's up in the New Jersey, New York area now, and she sees Roy, and she's almost clear. And
so honestly, Roy and I have not discussed this, but when you're, it's intuitive. You
Right.
have a device and you're seeing an issue on the skin, and you're like, hey, this would probably work to help that.
Yeah,
So
I love
it's exciting, yeah.
So Caitlin said, is there any concerns I should have for doing the pulse dye laser on the ear for a port wine stain?
No, I mean, just the typical concerns with any location. You want to make sure the energies are reasonable. So, you want to avoid blistering when you can, so that you can minimize any risk for scarring. But no, the ear should be treated. I treat ears all the time and no problems whatsoever.
Awesome. What would you say, this is from Sophia, is a good age to use micro needling RF? It's a good question.
That's a good question. So really with the babies, that's going to be very difficult, because one of the things with the technology is the needles have to go into the skin for a microsecond and then retract. So we can't have patients that are moving around.
Right.
So, I would wait until the child is a little bit older. Certainly there's no rush. These lesions keep remodeling, and recontouring till the children are at least 9 years old. So, I wouldn't be this particular patient that I'm treating is older. A teen, in fact, and is very excited with the results, but is able to cooperate with the procedure. I think on little babies, I would go with things like pulse dye laser to help with any residual superficial. The thing is, with the pulse dye laser, you're going to get only superficial changes. The Fraxel non-ablative, more superficial. When you get into the ablative, then you get into the same issue with pain, and you can't do large surface areas. So if you're staying non-ablative in little babies is what I would recommend. And then as they get older, then we've got other tools.
Awesome. So we can see we're live now on here. So I see us on here, so that's good. But we're live from the phone, but at least I can see all the questions now. So this is really great. So let me see. Kate Alana said, sorry, I only just logged on. What was the name of the treatment you just spoke of for improving the leftover skin from a hemangioma?
So there's a lot of different devices. It's called radio frequency microneedling. There's a lot of different devices. So I personally am a very big fan of the Morpheus 8. I feel that's what I have in my office, and I feel the company is very good and the technology is excellent. But there are competitors, and basically all of this technology, regardless of whether it's a microneedling device or a laser, it all is operator dependent. So just to make sure that the physician offering the treatment has
we can see we're live now on here, so I see
has experience with the technology.
I can see all the Sorry, I'm trying to find the volume.
I
can't find the volume. So we're gonna have double live feed. See, this is what happens. Oh, there it is. So we're gonna have double live feed. There we go.
There we go.
Better. I could have left it on here and turned it off there, but this is fine. I'm trying to see these questions. My son has a port wine stain which goes over his head. He isn't receiving laser treatment over the hair area. If the birthmark starts to grow, is there a need for treatment? Thanks. Sorry. From Germany.
Hi from Germany. So In general, we don't treat the hair-bearing areas because while the pulse dye laser does not remove hair, oftentimes it can thin it, and it can stunt the growth for fairly long periods of time, even up to 6 months. So in general, we're not seeing huge overgrowth in areas that are hair bearing. And if we see a little bit, it's pretty well masked by the hair. So in general, eyebrows are left alone, and things that are underneath the hairline, we don't treat.
Okay. So Kate says, when you get a chance, would be interested to know how eyelid venous malformations ordinarily are treated. In the UK, they appear to agree on a watch and wait approach until such time as impact on the vision. I imagine this is due to my son's age, 4 months.
So with venous malformations, and we had some interesting cases yesterday that we discussed. With venous malformations, as you get closer to puberty, they tend to grow, they tend to worsen. So definitely, I agree that we don't need to intervene very early. Of course, I'm not seeing your child, and certainly if it's impacting on the field of vision in any way, creating a ptosis or a droopy lid, something like that, that might be more emergent. But if the vision is intact, the visual field is intact, and your ophthalmologist is following along, there's no pressure on the eye, then maybe you can wait. I think it's tricky. You have to have very good imaging and make sure that this malformation, in case it was going to be sclerosed or something with an interventional radiologist, in the future, that you have to see where it extends. We had a case yesterday of a child with a lesion primarily on the cheek. However, the MRI showed that actually went around the optic nerve, and so that's quite risky to the vision. So there's a lot of factors to consider, and I would say that you really need to be in expert hands at a center that has a multidisciplinary approach to these lesions.
Yeah, I agree. And we do have an eye expert, Dr. Fay. If you want to email me or go to our website at birthmark.org and look at Ask the Expert, you'll see Dr. Aaron Fay from Boston. He's an orbit expert. He may actually contradict them and say this needs to be treated now so that you don't end up with astigmatism or some other problem, rather than waiting for.
That's why you need a multidisciplinary approch. Absolutely.
Yeah. And the only multidisciplinary group that I know of in the UK is at Gosh, the Ormond Street Hospital. So and I have Hillary, the nurse there's email if you want to email me at vbfpresident@gmail.com so you can talk to her.
And please send us pictures.
Yes. Sarah says, hi, my son has a port wine stain which goes over his head. He isn't receiving laser treatment over the hair area. Well, we already had that one, right?
I think so, yeah.
Yeah, maybe it came in twice. Hi, I'm from Australia. Hello from Australia, down under. My daughter has some kind of birthmark on the left side of her body, top, bottom, front, and back. What's the best thing for this? I did laser on the face. That helped so much. Well, I guess I'm assuming it's vascular, right? Red, pink, or blue.
It sounds like a capillary malformation. It's quite extensive. So for these, we definitely want to get genetics involved and see if there's any mutations that we can identify. Some of these capillary malformations are solitary, but sometimes they can be associated with underlying vascular abnormalities. So it is important. They can be associated with some overgrowth, let's say, that happens slowly over time. So it may not, I think there needs to be more of an evaluation here because that sounds extensive. Clipple-Trenanet could occur. It doesn't always have to just...
Sturge-Weber.
Yep.
On the face.
Exactly.
So, and I know you're down there, and on our website at birthmark.org, where you click on Find a Doctor, we actually have 4 or 5 doctors from Australia on there. I know Dr. David Lord is from Australia. He has a multidisciplinary group, so I don't know if you're seeing him, but those emails are right on our website. If you can't find anyone, then email me at vbfpresident@gmail.com and I'll get that to you. Caitlin said, when using the pulse dye laser, should you get the purple polka dots right when the area is treated. My daughter is 3 months old. So there's some controversy though. Stuart Nelson says you don't always get purpura, but it can still be working, but you want purpura. Dr. G likes purpura.
I'm more of the purpura family or train of thought, but honestly, you don't have to have purpura to have an effective treatment, because with lasers, you have energy and you also have pulse duration. So higher energy and shorter pulse duration is going to give you more bruising, more purpura. Okay, it's a really big snap. So there's a school of thought that thinks that that's important, and then there's a school of thought that thinks, well, you can broaden the pulse duration and then you give it more evenly so you don't get that much bursting of the capillaries. What you do is you get the heat is kept inside and then it goes away without so much bruising. So that's a broader pulse duration. And some dermatologists, and I'll do this, I'll alternate treatments. So treatments where you get a lot of bruise, treatments when you don't get as much bruise. But in general, I like to see my bruise. But you can adjust the parameters and get a bruise. If you stop getting bruising altogether, no matter the parameters, sometimes you're plateaued and you need to take a little bit of a break.
Agreed. I always say, and this isn't part of the consensus items because we couldn't reach consensus, but I say, if you've had 3 subsequent laser treatments and you're not seeing any clearance, then it's time for a pause because the laser just isn't reaching those vessels.
Right. If you're not getting for me, it's more the clinical endpoint.
Right.
Right. If you're not getting a bruise, then I think it's time to take a break. Yeah.
And sometimes change lasers, sometimes change settings.
Change the settings. Change
hi,
the
Madeline, saying hi to us.
And remember that even when you get, let's say, that 100% clearing, which is quite rare, these can reoccur over a few years. So don't be alarmed if that happens. You just need a little more treatment. These are malformations, so the body will continue to form these. But there's some people that are very lucky that the laser is just so targeted and the vessels are absolutely perfect for the parameters of the laser. It's not always the case.
Thank you for that. Apologies, Surah. I guess her name looked like Sarah to me, but she's said it's Surah. I'm getting used to these international names because we have people from Australia and UK. Hello from New Zealand. My son has a port wine on the left side of his face. I've noticed his upper left gum is swollen. His pediatrician thinks it could be a hemangioma. His doctor that performs the laser thinks it could just be the port wine. How can we know what it is? And do you know any dental experts in New Zealand with port wine experience, as I'm struggling to find one? We have one in the U.S., just saying. So,
just one.
You think you're going to find one in Australia or New Zealand, you're not.
So most likely it's not an infantile hemangioma. There could be some hypertrophy or overgrowth of the gum. It's not uncommon with capillary malformations to have the gum line involved. And it is important to have a dentist who knows about this. This is why the VBF does have a dentist on the team. And there's the meeting in October that's free.
Free dental exams.
Free dental exam might be worth
orthodontics.
coming over.
Yeah.
I do have a great pediatric dermatologist, though, in New Zealand that you may know is Dr. Elizabeth Alvarez Connolly. I don't exactly have her specific information of location because I know New Zealand is a big country, but we can get that for you.
Okay. Alrighty. Ashley is a 52-year-old with a port wine on her forehead, nose since birth. Recent brain MRI showed enlarged Galen vein and leaking vein. Neuro wants to do an arteriogram. So apparently Ashley is talking about Sturge-Weber, it sounds like. So make sure you get a neurologist that understands Sturge-Weber, and we have 2 of them involved with VBF, Ashley, that you can email. Dr. Comey from Hopkins and Dr. Pinto from Boston. So, because I don't know what to say.
I think it's reasonable to get the arteriogram if that's the question. Yes.
Yeah, that's the question.
Yeah.
I mean, it'll show. It's already saying that there's brain involvement.
Yeah.
But this vein of Galen, I'm not sure if that's typical because I know they see with the Sturge-Weber calcifications. I don't know if this vein of Galen. I don't know.
Yeah, I'm not
But
familiar.
you can talk to Dr. Comey and Dr. Pinto. If you can't get a hold of them, email me at vbfpresident@gmail.com and I will forward them your question, get the answer, and get it back to you. Marina said, when my daughter gets laser treatment, the doctor will occasionally hit areas where there is no port wine stain, and she gets a ton of purpura in that area. Is that damaging to non-port wine stain area if the thought is that the port wine equals success in removal of capillaries?
So I think that's a little bit surprising. Certainly if a child is moving, you might hit an area that's not part of the port wine stain. When that's happened to me, I don't get as much purpura there. There's always going to be some dermal capillaries in everybody's skin, so it will target those. It's not going to do any damage whatsoever. That will heal. Of course, we don't want to treat outside the border, so to speak. We want to color, stay within the lines, but this kind of thing can happen, of course, if you're doing treatments in the office and it's a baby squirming around. That's why it's really important to try to restrain the patient as much as possible during the procedure, but it's not going to do any damage.
And just speaking about that, I noticed, because I've observed you have like the mom cradle the baby while you're lasering. Yeah, I really like that.
So I was shadowing early on a dermatologist that did that, and I just thought it was great. So I like it better than the whole papoosing kind of thing. But different doctors do different things, and certainly the main thing is to restrain the child. But we do have the mom or dad hold the baby. Of course, we help. But I think just that, the physical contact with the mom and dad is helpful for the child.
Agreed. Melissa Chen, hello, Mrs. Cece, Chen Couples, Mrs. Cece. Dr. Duarte, would you recommend an ultrasound on a facial port wine? My port wine is across half of my face and the center of my cheek is much darker than the rest.
So yes, I think that ultrasounds are going to become more common in the evaluation of capillary malformations or port wine stains. You just have to have the right probe. You have to have a doctor that really knows how to do it, because otherwise it's not going to be very informative. Certainly, we've seen a lot of port wine stains, not a lot, but a percentage, where there's an underlying arteriovenous malformation. So if you're feeling any kind of pulsation in your port wine stain, or it's very hot compared to the rest of your skin, you expect it to be a little warmer because obviously there's more blood flow through there, but it shouldn't be a fast flow. So if you're feeling a pulsation, definitely get an ultrasound. Don't have any laser. There's a small percentage of lesions that look like a capillary malformation, and it's really just the tip of the iceberg of an arteriovenous malformation. So I think when you can, if you can get an ultrasound, it's great, but it's only as good as the person that's actually reading it.
And we actually saw her at the conference, and Dr. Coletti did the ultrasound and recommended an MRI. Okay, so she's asking, would that be a good next step as well?
Absolutely.
Her second question is, should he? Yeah. And I think he saw more activity than he liked. So he wants to see the MRI because there's this middle ground of port wine that crosses over to high flow, and he's like, I'm seeing a lot of activity when he was doing the ultrasound. So he's like, okay, let's just get the MRI and it'll be definitive.
I think so. It makes sense.
If it's just capillary malformation or CMAVM or
yes, correct.
Something.
So yeah, MRI is very safe. So I would do it.
Okay, so I think we're caught up on those questions. Once again, going back over here, and it's frozen, and I can't get into the rest of the questions, so I'll see them all on here. So once again, tomorrow is free laser day, and we're very excited. I think we have around 12 or 14 patients. We had one sign up last night, and it's a baby, and I'm like, never turn a baby away.
Of course.
And I know you wouldn't.
Oh no,
definitely. So I'm looking forward to seeing my babies tomorrow. I love my little birthmark babies. Okay, so yeah, thank you for posting that information. And then today we're doing Facebook Live. Yesterday we got to go in to see some imaging, which was great. And then we saw some patients, so that was great. So this is the first time we've been back together in person doing this since 19, and you were doing an annual vascular anomalies conference.
Correct.
So maybe next January,
Yep.
February, we'll be back to the full.
Yeah, we
full
were
conference.
virtual in
Yeah.
2019, and we haven't had our live meeting yet, but we will.
Yep. Okay, so what was that? That's okay. My baby's port wine is on the arm. No overgrowth that we can see. So far, 18 months old, but we were never recommended to get an ultrasound or MRI. Is there a benefit to having one done at this age, 18 months?
So I would start with an ultrasound, definitely, you need to follow that along and make sure that there's no, subtle overgrowth. My babies that have capillary malformations that involve an extremity, a leg, or an arm, I usually have them followed by orthopedics as well. They do really detailed limb length and girth measurements, so I want that to be followed. It's especially important in a leg because it's important that the legs grow equally and to detect that if there's a change. Very exciting is that there's a new drug called V-Joyce is the brand name. The name is alpelisib, but the trade name, the brand is V-Joyce, and it's this is a little technical, but it's called a PIK3CA inhibitor. And so these patients that have the overgrowth, they're in a category of diseases called PROS, which stands for PIK3CA related overgrowth syndrome. And the great news is if there starts to be some overgrowth, we now have very targeted therapy for this. So this is new. Literally last May, it was FDA approved down to age 2. Not saying that your child would need this at all, but just for everyone that's out there or listening, watching, that that this medication is available. You don't have to have the mutation. You really just have to have the clinical presentation of the overgrowth. So there's only a few physicians that are familiar with this medication since it's so new. In our group, it's our oncologist, because this is a medicine that was used for breast cancer. So you see we have a medicine, and then they found this application for it. And so it comes from our oncology friends. And so right now our oncologist is the one that's managing the patients that we're putting on the V-Joyce. That's the name that it's been given actually for the PROS related condition.
Yeah, and I know Novartis has been very spearheading the PROS population to try to get medication to do tissue reduction. And as you're talking about the alpelisib, I'm thinking of the port wine overgrowth lips, and I wonder if
so that's a yes. I think it's very interesting, and I've spoken to our oncologist. Anyone who's getting overgrowth with the Sturge-Weber phenotype, we know the genetic mutation is the GNAC.
Right.
So the thing is, it's not PIK3CA, but I found an article saying that there is some overlap in some cases of the overgrowth of the face with the Sturge-Weber that has some PIK3CA. So I would definitely want to get that test if it was my child, because this drug can offer hope for that. But right now it's most of the time they're going to say it's GNAC. It's not PIK3CA, so a different pathway.
Right.
But
so that drug works with specific vascular malformations, but not all. But I did have that thought.
Yes, me too.
And also,
and there's some literature, so it's not going to be. It's so new. We don't know yet.
Right. And also yesterday when we were at the clinic, your hemonc guy was talking about using this drug, doing the screening, and how it's going to work with overgrowth, or how it's going to work with any kind of vascular anomaly. And I guess I was wondering, how do you get the test for the mutation to determine if you're a candidate? And I think he said it was a urine test, right, to determine the mutation?
I don't think it's urine. I mean, I think it's
Like
just a blood test.
Blood draw?
Yeah,
Okay.
And you can also get tissue.
Also tissue.
Yeah, tissue,
Okay.
because some of these mutations are somatic, right? So that's just right in the skin.
Right.
And the drug, the thing is, it's extremely safe. So it's not an immune suppressant. It's a really big advance. I'm very excited for these patients.
I'm excited too, especially because we're seeing kids at 5 and 6 starting overgrowth. with
Yes.
a lot of lesions.
And it's helping adults too that have the overgrowth completely developed. So it's helping to reverse some of that.
That's probably one of the most exciting developments in the last year.
Yeah, beyond that though, the pain, they feel a lot less pain. So they, even if the overgrowth follows slowly with the reduction, they feel a lot better because a lot of times they're associated with pain.
And the pain is from the nerves, and the nerves are impinged on the overgrowth because the overgrowth's not supposed to be there. I always say God intended our body to work the way it works, but when something's there that's not supposed to be there, we have messages, and that's what the pain is. The pain is the growth, and the growth presses on the nerves, and the nerves causes the pain. And there's, I was talking to Dr. Restrepo yesterday about that, the FAVA cases that have a lot of pain, and I'm wondering if maybe they should try it, because even if it gets minor tissue shrinkage, it might be enough to stop the pain.
It has to do with the pathway though, right now.
Right, so if it's
targeted.
MMP, PIK3CA, whatever, you'll have to find that. So Tiffany wants to know about her son. He has a port wine on the eyebrow. Why you don't treat the eyebrow? And she said his doctor said he'd lose the eyebrow hair on the area he lasers, but it'd grow back. Is that correct?
Yes. So it's up to you. I mean, certainly a lot of doctors do treat the area. You just shave it and then treat it. And then over time, the eyebrow will come back. But, some people, it's a little bit, disfiguring not to have eyebrows. And, for the kids going to school, it can take 6 months to recover. And since you're in ongoing treatment, you just have to be okay with not having a visible eyebrow for the duration of treatment.
Now, I know this might be a dumb question, but I had some moms ask me this, and I said, well, I'll have to ask Dr. Duarte. They wondered if the eyelash serum, which I use and it works.
Yeah, the Latisse.
Could they put that on it, and would it stimulate the hair to grow back a little quicker?
It might, yeah, sure. Rogaine also, 2% Rogaine. Latisse will help with the recovery, absolutely.
And there's no downside.
But remember, laser is repetitive. So
right. So the hair come back and you're removing it again. The hair comes back.
So you just have to be ready to have that cosmetic issue for the duration of the treatment, which sometimes could be, years. So, yeah.
Well, if you do Dr. Geronimus's new protocol, it could be weekly.
Well, that's true, yeah.
That's new, though. That's very
that's
new.
Exciting.
So Emily said, I've had 7 to 8 laser surgeries on my port wine stain when I was a child on my leg. Has the laser changed since the 90s?
Yes.
Is it more difficult to manage on the extremity?
So definitely the extremities are more recalcitrant to laser treatment, but laser technology has improved quite a bit since the 90s, so I would definitely revisit that.
Yeah.
We have a new technology, the V-Beam Perfecta, and also the V-Beam Prima. But the V-Beam Prima hasn't been relaunched yet. Right now, you can't get a V-Beam Prima. There's some that are out there already on the market, and they were working out some kinks with the technology and just and educating, and kind of went back to the workshop on this. And I don't know when they're going to relaunch. I'm going to the Academy of Dermatology next month, so I'm going to find out. But yeah, there's some technology where we have more energy, bigger spot sizes. We have better cooling, so we can treat more aggressively to get deeper without damaging the skin. So, and more comfortably, so you don't feel as much pain. So yes, a lot of new advances.
So this is one, Ali Skuzubak says, we love Dr. Duarte. She did wonders for Maverick.
Oh yeah, hi. So sweet.
So Emily wants to know, how would we go about getting the genetic testing to see if we are eligible?
So for the genetic testing, you in my institution, for instance, you can get it through our oncologist or through the geneticist.
Right, and we've been trying to get this program going with this geneticist from the state of Washington who does most of the vascular anomalies. And I've been working with him on an abridged test that would be very affordable, because right now the families most of them pay cash.
It's hard, yeah, it's expensive.
And it's like
I think
$1,500.
Yeah.
So what I asked him to do is, can you come up with a $750 option? and then we would raise money to kind of jointly, like 50-50 type thing, just to make it more affordable. Because with the way the genetics are coming out and everything we're hearing, I mean, this is going to be definitive for treatment, is the genetics. You got to find out which mutation and know which drug. So, Scott said, I've had 20 plus PDLs each time I need topical numbing to help with the pain. What ways do you manage pain for your patients, and what do you see for the future?
So right now, honestly, so the patients, I don't do a lot of topical numbing for large surface areas because it can be dangerous with too much absorption of the lidocaine. So right now you have the DCD, which is a dynamic cooling device. On the Prima, you've got the actual, it's kind of like a cooling piece of metal, literally, that just comes right on the skin and actually cools the skin. It's quite effective. That's really what I do. I try to get my patients through it. Sometimes if you numb, sometimes you can cause a little vasoconstriction, which kind of impedes the efficacy of the treatment. So
counterproductive.
I feel your pain. It's not pleasant, but right now we've got the DCD, we've got limited topical numbing with possibly interfering a little bit with the efficacy of the treatment. So certainly in some patients, you go to the operating room and you get the anesthesia. Maybe some dermatologists will have nitrous in their office for other reasons, for other procedures. Yeah.
Dr. Friedman has the nitrous oxide, and he was using it during his free clinic, and he said it was a game changer.
Yeah. So the nitrous oxide, some doctors may offer that.
Sharon Verheis says, hello, doctors. God bless you all. Thank you, Shannon. I want to make sure I didn't miss any. My daughter, 57, has a port wine over her upper lip since birth. She has overgrowth. Her right side upper body from waist up and her left side waist down, KTS, Sturge-Weber. Would she qualify for the genetic test for possible?
So she probably wouldn't. She would probably qualify for the medication just based on the clinical presentation. You don't have to have the mutation with this clinical presentation. But yes, she would definitely qualify for the test. But you can use the medicine based on the phenotype, just based on the presentation. That's what the phenotype means, what it looks like.
Right. And obviously, she's saying Sturge-Weber and clippertranate.
Exactly. See, these things overlap. It's a spectrum.
Yeah, it is. It's a spectrum.
So absolutely. And if I think she said there was overgrowth on the
she said there's overgrowth on her right side upper body from waist up, and on her left side waist down.
Right?
Yeah, she did mention.
It would be interesting.
She has over her upper lip since birth. She has overgrowth.
Yeah, so this would be an interesting patient to get back to us if she noticed that the lip improved.
Yeah,
that's how we're gonna learn. That's how we're gonna learn.
And we want. How often do you think you're gonna find somebody with lip overgrowth, KTS, Sturge-Weber?
Yeah,
she's a gold mine for us there, Dolores.
Yeah,
so
we need to know how this goes.
Let us know where you live, and I mean, I know a couple, like the geneticists in New York, and a couple, but I don't know what state you're in. But we have to find somebody that knows how to test for these genetic mutations, or a geneticist that's familiar with.
Yeah, absolutely.
Familiar.
Yeah.
So you can email me.
But she can just know what she needs. She needs to get the PIK3CA. Yes. PIK is PIK, literally a C, 3A. That's it.
She lives in Miami.
Oh, perfect.
She can come to see you. You should come tomorrow for free, and then we can get her in the system. So we're at Nicholas Children's Hospital tomorrow from 9 to 3.
Yeah.
And you're more than happy to come. We'll fit you in. Would love to see her. Yeah, you live in Miami, Dolores. That's unbelievable.
Yeah,
if you can come, Nicholas Children's Hospital, just tell them you're here for the free clinic with Dr. Duarte, the Vascular Birthmarks clinic, and we can fit you in between 9 and 3 if you want to bring her. And then we could network her to your hemonc person, to your group to get that done. This is exciting. You have to get back to us on this. So Carl said, my daughter has had debulk surgery on her vascular birthmark on the left cheek prior to sclerotherapy. And is there a recommended maximum amount of sclerotherapy injections as a guide? Yes, there is.
It depends on what's being injected. With
Right, that's true.
bleomycin, yes. There are others that no. So with bleomycin, yes, there's a maximum dose. So it depends on what's being injected.
Okay. So Dolores, if you're only a few minutes away, we expect to see you tomorrow.
Yeah.
With your daughter. So please come. Is Dr. Restrepo going to be with us tomorrow?
I don't think. No, he's got the festival. Yeah.
Oh, that's right. I just think he would like to see some of
Absolutely.
these cases.
They're all invited.
Yeah, so that's great. So that's great, Dolores. You see, this is why we do these lives, why I'm in town and where I am.
Exactly.
There's a perfect example of a patient who could be seen tomorrow for free and get into your system,
Right.
and get her testing done and get her on this medication, and then we've got our person.
Yeah.
And you should even like maybe measure and see what
we'll
the
take good pictures.
and measurements like on the
exciting,
areas.
yeah.
So talk your daughter into coming, Dolores. That's your assignment. You have an assignment from Dr. Linda and Dr. Duarte. Talk your daughter into coming to see us tomorrow. Okay, so we're down to 10 more minutes of this live session. We can still take some more of your questions. Once again, tomorrow is our free laser day and consultation clinic. So even if you're not sure of what type of doctor you should be seeing, you can come tomorrow and get an opinion from Dr. Duarte and myself. You know, she may say, okay, we don't do this here, but this is where you could go and get that taken care of. So again,
course, yeah.
9 to 3 tomorrow at Nicholas Children's Hospital. We have like 10 to 12 patients coming. KD wants to know what medication is best for the TY2 mutation. I think that's the venous malformation, correct? TY2?
I'm not 100% sure. But for venous malformations, I don't know that we have a really good treatment for the...
I have a paper, the paper that was published by Aaron Green, and it has each mutation and then what is the recommended. Now, it's not current, it's like 5 years old.
Yeah,
so
venous malformation.
Yeah, that's...
Honestly, for venous malformations, I don't know of a good medication for medication. Sometimes, did we talk about sirolimus yesterday? A little bit, maybe. But it's combination of interventional radiology, combination surgery, and maybe sirolimus, which is also known as rapamycin.
Right. So if you want, Katie, you can send me a picture at vbfpresident@gmail.com and just remind me that this is about the TY2 mutation, because I know Dr. Laurence Boone and Mika Vicula also have just updated the genetics.
She didn't do well with sirolimus, yeah.
Oh, she already tried it and didn't. Well, then she could do well with alpelisib.
I don't...
Yeah, because it's TY2.
Where is it? Where is the vascular malformation?
Yeah, where is it located, Katie? So it's for herself. So it is venous, so that is right, that TY2 is connected to venous. That's what I thought.
Yeah.
I mean, there is
interventional radiology, possibly sclerosing.
Yeah.
Where is the lesion?
Yeah, that...
on the right arm.
Oh, right arm. Okay.
We could ask her, have you been imaged?
Well, I mean, she was on sirolimus,
so it must be quite large.
Yeah, and if she was on that, nobody's just going to randomly give her that.
It's
got to be
extensive.
But there's got to be somebody that understands these that would say, let's try sirolimus. But still, you can send me your pictures, and I can get some other opinions in my VBF experts group.
Where is her, where is she located?
Oh, yeah, sclerotherapy caused me to lose usage of my right arm. Well, I mean, could be depending on who you went to. I mean, there's good and there's not good.
That's unfortunate.
So again, Katie, let me know where you live. You do sound like you've got a delicate balance here.
St. Louis. Yeah,
okay.
This is, I don't know.
I would actually probably send her to see Gresham Richter, Dr. Richter in Little Rock, Arkansas. He and Dr. Sun, and I forgot the third doctor. They're really, and Joe Edmonds, Dr. Edmonds in Texas, he's very good with the bleo. I don't know her age, I forgot, but she wouldn't be able to come here, I think, because she's over 21. But you can message me. Hi, Marge O'Connor. So message me at vbfpresident@gmail.com.
And maybe the October meeting would be great for her.
Oh, yes. Thank you. Thank
Yeah.
you for saying that. So, Katie, it's at birthmark.org, and I think we are launching it, or it may have launched, but we have the VBF Big International Super Clinic Conference the weekend of October 7th and 8th in New York City. You get free hotel, free ultrasound, free consultation. If you qualify for laser, you'd get laser, but you don't qualify for laser. But still, we'd still be able to see it. And of course, depending on if there is a superficial component, Dr. Geronimus may try, but who knows. But still, if you come, Katie, to that, it's free.
No,
And-
plus you have all these world experts.
Right.
And
Extremity
it sounds
experts.
like this is a complicated lesion.
And Dr. Coletti is very familiar
Yeah.
with the mutations and the drugs, so you could come. Could we schedule to come out to the clinic in the future to determine what specialist we should see? I'm out of state. Oh, okay. Yes.
Yes.
Yes, you can come and see Dr. Duarte.
Where are they located?
Oh, in New Jersey.
Oh, yeah, so then they need to go somewhere in New York, Roy Geronimus.
Well, I mean, if she's from here, then she can see you.
Yeah.
If you're in New Jersey, depending on what the lesion is, you can go in and see Dr. Geronimus. So you can, Emily, you can just text me.
There was a question higher.
Oh, I'm sorry.
Follow up, yeah, there.
Oh, my son's pediatrician wants to do an MRI to see if my son has Sturge-Weber, given that my son has port wine on the left side of his face and the swelling of his upper lip and gum. Well, she does need imaging.
Yes.
And as long as he's over 1, because Dr. Comey says prior to age 1, you can have like a false positive.
So we do recommend imaging for the port wine stain if it's involving what's called V1 and V2. If it's only on the mandible or the lower part of the face, it may not be required. So it's going to depend when you say it involves the face, but you're not specific. If it involves the forehead or even a little bit of the upper eyelid, just the smallest
and the temple,
amount.
And the temple.
Yes. Even just the smallest amount, then yes.
Yeah.
But if it's literally just down here, this is called V3, and then you wouldn't necessarily need an MRI.
Yeah, so it's just like this area
Yeah.
and back.
Yeah.
Because it could even be like on your here and
Yep.
not even near your eyes.
Exactly.
And we've seen Sturge-Weber in those cases. So Sherry says, I have a 3.5-month-old granddaughter with port wine stain on her left side of her back, onto her left thigh as well. A ped derm examined her and said she would be shocked if it were KTS, but everything I read points to KTS. Should we insist on an ultrasound? Well, again, to see, what we're doing, no signs of overgrowth. So you can tell KTS because it's missing that deep venous part.
I would get an ultrasound of the extremity, yeah.
Yeah, I was going to say Dr. Coletti can do it for free. We are having, by the way, before I go off, we will be doing a free ultrasound clinic for everybody that's still on in Boston in April, because we're both going to be at this ISFA meeting. We're going to offer a free ultrasound clinic because he's got a lot of patients with AVMs from the U.S. that need follow-up. So we're going to be launching that on the VBF website, birthmark.org, next week, where you can sign up for a free ultrasound in Boston in April. So again, all of you are entitled to come to it. It's free. But I would insist on that ultrasound on the 3.5-year-old.
Again, from a radiologist that understands what we're looking for. Because even, there's a lot of centers that are very reputable, but they don't have a vascular anomaly specialist.
Mm-hmm.
So, you just need to inquire what the expertise is. And if not, find someone locally or even out of state. Remember, we talked about this. The imaging is only as good as the radiologist reading it.
Exactly.
Yeah.
So this looks like it'll be our last question. Jessica says, my son is 9 months old and has a hemangioma on his forehead. He finally started a treatment with hemangiomas, good, last Wednesday. Is the medicine really going to help it shrink faster? I wished he had started it earlier, but hopefully it will go away before he starts going to daycare. So he's
So definitely we're starting
9
We're
months.
starting a little bit late. We
Yeah.
usually like to start at about 1 month because it seems like by 9 months the proliferation has already occurred. But definitely I've seen bond even though you started late. So I think that definitely you want to make sure you're on a good dose and get that going. And hopefully your child will be a responder and will catch up.
Yeah, keep track, take pictures weekly. Sometimes subtle changes aren't even noticed unless
Yeah.
you go back.
And you need to go
Because you see
on
the baby all the
yeah,
time.
you need the medication on for at least 6 months. At least 6 months.
Yep, agreed. All right, everyone. Well, thank you.
You're
It was a
welcome.
little technology issue in the beginning, but we did it.
We got
We
through
got
it.
it done. That's why I always bring the phone, the iPad, and the laptop in case something goes wonky on me. And today it was the laptop. So thank you all, and thank you, Dr. Duarte. And I will be back next year in person with her, but she will also be with us in New York City
Yes.
at our super clinic in October. Thank you all. Stay safe and stay well.